So we'll be talking about stroke and heart attack. So if you look at the ACLS guidelines, they will say that stroke is a brain attack. So that's why they are very similar. Heart attack is heart attack, which is myocardial infarction, and stroke is a brain attack, which is called cerebral infarction. At the end, both of them have infarctions, the word added. By the word infarction means that all on a sudden an area of the organ loses its blood supply. So what does that mean is a small area of the organ can become dead because there's no blood supply. So either in the brain or in the heart. So that's where the name infarction comes from. What are the causes of infarction? So blood supply was there, all on a sudden there's no blood supply. So it can come from two different ways. One is a thrombosis and the other is embolism. So thrombosis means that an artery will become thrombosed or clogged up. So blood can't go any further. And embolism is somewhere else there was a clot, and that clot comes to the artery and makes it at a dead end. So the blood can't go any further. So the area that is supplied by that particular artery will be dead. That's the infarction. So it can happen to the brain, it can happen to the heart. What are the risk factors for these two? Because the reason we are doing two together is they share the same common pathway to have these two problems. So there are certain things that we can't modify. We can't modify our family history. The scientists have found out that there is certain conditions of the cholesterol that are connected with these risk factors for heart attack and stroke. What is that factor? The factor is that elevation of the LDL cholesterol. So LDL cholesterol is produced in the body, and there is a mechanism by which LDL cholesterol goes high, that causes the arteries to be thrombosed because of the cholesterol plaques, and that causes heart attack and stroke. Now, can we do anything about it? Yes, that is modifiable, even though that's part of the family history, but that part of family history can be modified. By doing what? By doing lifestyle modification, like doing regular exercises, weight reduction, and certain medications, which is called statin. So statin are the medications that brings the LDL down and prevents people from having heart attack and stroke. Now there's a very, very important thing that we need to understand, that cigarette smoking, tobacco, that is a risk factor for both heart attack and stroke by the same means, atherosclerosis, and they can cause both heart attack and stroke. There are other factors. The most important of them is diabetes. So if the diabetes is not under control, then you are at a risk factor for both heart attack and stroke. Of course, if you have other risk factors, for example, cholesterol and family history, then your risk factor is multiplied. So that's why lifestyle modification comes also into a play here, to healthy lifestyle including diet and exercise and those cholesterol medications and good control of diabetes. So in diabetes, we do a test called hemoglobin A1C. That hemoglobin A1C test is directly correlated with the frequency of stroke and heart attack. If somebody has a high level of hemoglobin A1C, which means that poorly controlled diabetes, they are as a very high risk factors for stroke and heart attack. Also, hypertension has a role to play for the heart attack and stroke. Now, there are certain other things that are risk factors for stroke, like certain heart conditions that can cause stroke. Like, for example, rapid irregular heart rate, which is called atrial fibrillation. That is a big risk factor for stroke. If you or your doctor identifies that you have a rapid irregular heart rate, which is called atrial fibrillation, you need to talk to your doctor about the treatment, and the doctor will prescribe you certain blood thinners to keep the blood thin, so you eliminate the risk factor for the stroke and heart attack. So if a small area of the brain is involved in a stroke process, then you may not have a big symptoms. Like you may have a little slurred speech for some period of time and then get better. You may have a problem with the vision, tingling, numbness of the extremities, weakness that get better over a period of time. We call them TIA, or transient ischemic attack. So basically they are warning signs that you have a risk factor for stroke and your body has conditions that can lead to stroke, and any time that you can have a stroke. In those situations, you have to have preventive measures to take care of the stroke. So basically, when you talk to your doctor or primary care doctor, they will prescribe you some form of blood thinners in these situations. And so when stroke happens, there are certain tests that we do to find out the reason for the stroke. If we can find some correctable cause that can be treated. Like for example, as I mentioned, atrial fibrillation is a risk factor for stroke. Sometimes we do echocardiogram to find out any structural problems in the heart that leads to stroke. We do ultrasound of the neck arteries to see if there is any blocked arteries, arteries inside the skull to see if there is a blocked arteries. Those arteries can be opened up by intervention radiology. So that's how we treat the stroke. But there's one other big thing about treating stroke is treating the symptoms. So we call it restorative therapy. That means that somebody can have a mild stroke. Every single person who has a stroke and goes to the hospital, we ask 3 types of therapies to look at that person: physical therapy, occupational therapy, and speech therapy. So they figure out what type of rehabilitation that we need. Some people need acute rehabilitation for the stroke, and some people may not need that, outpatient therapy. But physical therapy, gait training, speech training, swallow training, those type of things are needed. Some people do not have the function at all. In those situations, we have to find out alternative treatments. For example, if the person has dysphagia or he can't swallow at all, in that case, we have to have alternative feeding, like the feeding tube or something like that. Those are the restorative therapies that we can do for stroke. The blocked arteries are the reason for the infarctions. So we call it PCI, percutaneous intervention. It could be a balloon or a stent placement of the affected arteries. The damages can be minimized and patient can restore the rest of the function of his heart. They need to be on certain blood thinner medications. If they have intervention, like with the arteries, they go in and open up the arteries, then they need to be on some antiplatelet agents. As we know, there is a platelet in the blood that causes the blood to clot. So platelets function should be prevented to prevent further clotting of the arteries of the heart. And then lifestyle modification, of course, will go.